Hello, my name is Rayanna Pitch, and I am a fourth-year nursing student, and today I'm going to be teaching you about prevention of sickness and disease. We tend to notice that we get way more sick during the winter months rather than the summer months, and for a good reason. This physician shares that viruses like flu, COVID, and RSV tend to peak during the winter months, as well as indoor spaces increase a greater exposure to germs because there's a difference in the circulation and ventilation. In the summer months, we tend to be outside, playing with family and friends, being at the beach, going for walks, but during the winter months, we tend to not like to do that. So now the question is, how do I prevent getting sick? Well, according to the CDC, there are 6 different ways to reduce the common flu. First, it's important to know that if someone is sick, to avoid close contact. During the COVID years of 2020, we knew that 6 feet was a proper distance, but essentially if someone is sick, we should not get near them, we shouldn't shake their hands, and we shouldn't give them hugs, because that just exposes us more to illnesses. If you are personally sick, it's important to stay home. Church is always available virtually, and so if someone is starting to get symptoms like a cough, sniffles, or kind of feels feverish, it's important to just play it safe and stay home. We know that the older in age that people get, sicknesses can kind of hit them harder. Like an elderly person could be out for the count for a while. Next, cover your mouth. When you're coughing, it's important to cough into the elbow of your arm. That allows us to stop our spit from spraying everywhere and getting on tables, on other surfaces, and getting more people sick as well. It's important to know to clean your hands often. You want to go in the bathroom, wet your hands, lather them with some soap, and scrub them for 20 seconds. And then you can rinse them off and dry them. We want to wash with lukewarm water, and so we should wash before going in the bathrooms if we know we had been touching a lot of things, after we go to the bathroom, before we eat, after we eat. If you blow your nose, it's important to wash your hands as well. But in between times of washing your hands, you can use alcohol-based hand sanitizers. It's important to know to avoid touching your eyes, nose, or mouth. Like I said earlier, those are the passageways for viruses and bacteria and gross things on the surfaces to get into our system and get us really sick. So it's important to wash those areas like your hands and tables and just avoid touching your face. Lastly, it's important to practice good healthy habits like sleeping, drinking lots of fluids. Physical exercise and stress management are just a few examples of ways that you can prevent yourself getting sick. It's important to know where all the resources are throughout the church and what they do to help prevent sickness and disease. First, there are hand sanitizer stations all throughout the church, and so feel free to just wash your hands. In the middle picture, you can see that they provide masks. It's by the welcome monitor in the courtyard. You can just throw on a mask if you're kind of feeling under the weather. And lastly, there are these signs on the right all throughout the church to help remind you and teach you how to cover your cough and how to clean your hands. These are the resources I used, and thank you for listening. If you have any further questions or suggestions to prevent sickness and disease throughout the church, you can talk to the nurse, Kristen.